Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am back in the Sunflower House. And this episode is on, does anxiety age women? Anxiety is more common in women. And of course, we women at midlife and beyond want to stave off any accelerated aging. And unfortunately, the mental effects of anxiety do translate to physical effects. And that even includes changes at the molecular and genetic level. Telomeres are DNA protein complexes that cap the chromosomes and promote chromosome stability. And telomere shortening has been shown to occur in anxious individuals. And this shortening of the genetic material in your cell has been estimated to age someone by at least 6 to 10 years. Now, I'm sure you can think of people in your circle who are very, very anxious and who do seem much older than their age. Now, research has shown that women's reproductive factors affect aging and telomere length. So, what causes shorter telomeres, which you don't want? Stress hormones, glucocorticoids like prednisone, and any inflammation can all shorten telomeres. Cigarette smoking accelerates aging via multiple mechanisms and thus shortens your telomeres. Chronic stress and childhood adversity can shorten telomeres. It's one of the reasons why our functional medicine doctors take such detailed histories, including childhood and even birth. And loneliness can shorten telomeres nearly as much as cigarette smoking. And it's been said that loneliness, which is really at epidemic proportions, sadly, is equivalent to smoking a half a pack of cigarettes a day. So if you shorten your telomeres, you have a higher risk of cancer and heart disease, osteoporosis, dementia, arthritis. Now, certainly all those conditions are more common with age, and please listen to our podcast on many of these topics, including the one on osteoporosis, because there's so much that can be done. The same of arthritis. We've made great advances in treatment and in joint replacements. And in dementia, which affects 1 in 2 women by age 85, you really want to start a program as early as you can, and certainly by midlife, to help protect your brain. So, what's all the fuss about longer telomeres? Well, on the flip side, long telomeres are related to healthy aging and overall longevity. Yoga, a heart-healthy diet, and increased physical activity can protect telomeres from shortening. In fact, before I sat down to do this podcast, I was out doing some exercise. And longer telomeres are associated with a later menopause, and we know that a later menopause is associated with a longer lifespan. We women actually start out with slightly longer telomeres compared to men, and women in general do tend to live an average of 5 more years than men. And estrogen exposure increases telomerase activities throughout the body, which can protect and elongate telomeres. Not surprisingly, happily married people have longer telomeres and longer lifespans. I've just seen countless women plagued by anxiety disorders, including panic attacks, phobias, or just general anxiety disorders. They're distraught, exhausted, hypervigilant, and unfortunately, they're increasing and accelerating their aging process. So this is a relatively newer area of research, but it does appear that we can act to protect our telomeres and maintain our telomere length, increasing health, longevity, and vitality, which is right up our mission to be strong, be healthy, and be in charge. So, here are some 5 things that you can do to protect your telomeres and avoid aging. Avoid inactivity. More motion and movement is generally best. Avoid weight gain. That's the biggest concern midlife women have. I hear it every day. And if you haven't listened to the fabulous CME podcast with Dr. Tara Iyer, who's board certified in obesity medicine, please tune in to that prior episode. I think it should go without saying not to smoke or use nicotine products, but we have to emphasize this. Eat a healthy diet. A Mediterranean heart-healthy diet is excellent on the skin and the heart and the brain. And finally, you need to reduce anxiety levels. A little bit of anxiety can be motivating, but too much is destructive. So what are some ways to reduce anxiety levels? Number 1, see your physician, because you need to be evaluated for underlying medical conditions. You need advice and counsel, and you might potentially need medication or non-medication therapies to help reset your autonomic nervous system. You should never go to continue to suffer with continued panic attacks. Every week there's someone in my menopause clinic wondering if her female hormones are, quote, out of balance. And sometimes the hormones are out of balance, but other times it's simply too much adrenaline and neurotransmitter imbalance. If you didn't listen to my podcast about neurotransmitters and why women crave chocolate, that's a good one to go back to listen to. In fact, a little tip, I'm not sure if I went over about chocolate and why a lot of women crave chocolate, because it helps the neurotransmitters. But there's also a lot of magnesium in chocolate. And if you're a chocoholic, and of course you're watching your waistline, you may want to start taking some magnesium glycinate, because in a lot of people, that stops the chocolate cravings. And magnesium boosts dopamine, that feel-good neurotransmitter. If you are plagued by excessive fear, anxiety, or a phobia, you really need to visit a trusted physician. And as I always mention, these podcasts are not medical advice. They're just designed to empower you to be strong, be healthy, and be in charge, and know how to access information that can help empower you and improve your vitality and hopefully your longevity. And for other more detailed information on all of these topics, please be sure to visit our website, speakingofwomenshealth.com. And if you're not already a member getting our free e-newsletter and e-health tip, you can go on and in a couple clicks sign up for our terrific newsletter, which alerts you to upcoming events and breaking health news and fun recipes. So besides seeing your healthcare clinician, take a deep breath. Anytime I'm looking at my clock and my watch, I'm concerned that I'm late because I jam so much into a day, I try to reset and rebalance with a deep breath. Just take a deep cleansing breath. Take a walk. That's one of the best things if I'm feeling keyed up or anxious about needing to make deadlines. Rather than just dive into the work, I like to go out for a brisk walk. Yoga. This is a wonderful option. I'm not a yogi. I wish I was. I wish I was a little bit more flexible. So certainly all these options need to be individualized and tailored. But yoga is an excellent exercise that really focuses on the mind-body connection. And it does involve controlled breathing and mindfulness. And that can be done independently of the physical poses and stretches. We do have really good research that suggests those who incorporate the same mindfulness they have on their mat into their regular lives have much less day-to-day anxiety. Because yoga is said to increase levels of GABA in the brain. And GABA, G-A-B-A, is a neurotransmitter whose levels are directly correlated to anxiety, mood, and stress. In fact, a lot of women with PMS, premenstrual syndrome, or the more severe PMDD, premenstrual dysphoric disorder, many of those women are lacking in GABA.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Get a massage. Oh, that's one of my favorites. And I'm envious of some of my friends, you know who you are, who get regular massages. I think I need to put that on my to-do list. And if you're feeling stressed or you just want to reach for some high sugar, high carb, high fat, non-nutritional snack, just ask for a massage instead. When I have the chance to sit back and relax during a glorious pedicure and foot massage, I envision that my telomeres are lengthening. So take time every day to nurture yourself and seek personal peace. Your telomeres will definitely thank you. Many people find that their spiritual connections and their faith is very much comforting and reassuring, particularly during periods of stress, grief, and loss, but even just during regular life. And for those people that have faith and spirituality in their life, they many times have much better health outcomes, including with major surgeries, actually, and research has looked at this. We've got a really good information on our speakingofwomenshealth.com website that talks about life transitions treating anxiety and depression. And this was written by a psychiatrist, Dr. Joseph Baskin. And he talks about when our stability is threatened, stress levels rise, and stress coping strategies are tested. Certainly, everyone in the last 3 years with the COVID pandemic experienced unprecedented anxiety, stress, change, people that were not allowed to work or go out or exercise. I mean, this is having rippling effects on people's health. So anytime there is going to be increased stress levels, our stress coping strategies are tested. Sadness and anxiety can flare during times of change, even good change, like vacations, or moving to a new home, or starting an exciting new job, or seeing your child off to college, getting married, planning for your child's wedding, even very, very happy events, getting ready to welcome a new baby into the family. In fact, tomorrow is the due date of my third grandbaby. I'm so excited. And even though it's a very exciting, wonderful, joyous, blessed event, it does raise anxiety levels because it's a change in what is going on. Now, sadness and anxiety can flare at times of change, even happy events. And prolonged stressors and anxiety, especially mixed with the situation of hormone deficiencies, which plague a lot of midlife women, as well as just other medical problems that may come on with aging or other conditions, they can all compound anxiety and depression. So some of the symptoms of feeling out of balance or out of your natural equilibrium can include feeling blue or losing interest in activities. The medical term for that is anhedonia. I'm always very concerned when I found out that a prior pleasurable activity or hobby no longer interests my patients. Feeling on edge, jittery, just excessive, needless worry or difficulty concentrating. And I think with our high-paced life, with all the technology and blue screens and endless activities and constant information streams, a lot of people don't compartmentalize that. And that can increase people feeling on edge and simply not concentrating. When the duration of these symptoms extend into the weeks, it can become a diagnosable medical or psychiatric condition. And even people who've never had any prior mental health issues can experience the emergence of such symptoms around perimenopause. Certainly, dramatic hormonal upheaval can lead to previously unexperienced sadness and anxiety. And sometimes this happens for the first time to women who are postpartum, which is a dramatic physical change and huge drops in hormones. And if you've ever had a prior postpartum depression or severe premenstrual dysphoric disorder, PMS, you certainly may be at increased risk for depression at midlife. And women that have an overt psychosis, which is a serious life-threatening psychiatric condition after childbirth, many times this is the first indication that the woman is suffering from bipolar illness, which requires special treatment and special expertise, lifelong medical and psychiatric therapy, important to maintain normal circadian rhythms and regular sleep and mood stabilizers and avoiding triggers, because this is a very serious condition that puts a huge, huge strain on the woman herself, or men can certainly have bipolar, as well as their entire family. Sometimes I say that bipolar illness is actually even harder on the family than the person who might be experiencing mania, lack of need to sleep, excessive shopping sprees, manic behavior. And in general, though, midlife and menopause, when the children leave the nest, contrary to popular belief, is not a typical time for depression. Actually, women in their 30s with young children tend to have higher rates of depression. A lot of women at midlife, when they're freed from regular periods, concerns about pregnancy, and especially being freed a little bit from child-rearing responsibilities, feel energized and take the time to focus on themselves, pursuing new activities, hobbies. Like I joined a golf league once my children were kind of all sprung. Some women get back into the workforce or focus on their career. Other women throw themselves more into their community or volunteering or church or synagogue activities. But psychologically, menopause certainly can herald other changes. Some women who put their careers on hold to raise their children because their main career was focusing on their children and their family can now focus on other activities. So many new possibilities that initially seem tantalizing can sometimes feel overwhelming for others. Finding meaning anew can become challenging. Another danger that can accompany the consummate caregiver, which is many women, not all, but many, is that special woman who provides all of herself to those she loves, is that she can certainly grieve when her job is done and her children are all grown. And there's a risk of feeling bereft of support when she's looking to get her own needs met. So certainly, therapy and activities that can help with depression and anxiety should be focused on. And if you or a loved one is experiencing persistent symptoms of being blue or being anxious, you should see your primary care doctor or maybe your OBGYN, or if you have a mental health counselor or psychiatrist. If you're at midlife, you should be evaluated and see if you're a candidate for hormone therapy. which is not a treatment for depression or anxiety, but certainly can lift the mood and can help augment therapies. Many women want to avoid medications, and psychotherapy can be an option, both group as well as individual cognitive behavioral therapy. If you are experiencing and developing panic attacks, you really need to seek out expert evaluation and treatment. In fact, on average, women with panic disorder see many physicians, neurologists thinking they're having a stroke, cardiologists thinking they're having heart attacks, gastroenterology doctors, internists for diagnostic evaluations. And many times the symptoms are so dramatic, so intense, waking people out of sleep, making them head to the emergency room, and panic attack is not addressed. And it's a very treatable condition. Certainly, if you feel like life isn't worth living, you need to contact suicide prevention resources as soon as possible. If your symptoms are very mild and you really like the self-help only type activities, then definitely focus on exercise, which everyone should anyway, and diet, which eating a healthy food, you are what you eat. You need to go back, listen to some of our great podcasts on superfoods. And yoga, and we have a lot of information and detailed information about yoga and the health benefits. In fact, maybe I should try to get one of my graduated fellows who's now a staff physician in specialized women's health and breast medical care, Dr. Sabrina Sani, who practices yoga and has written columns on our Speaking of Women's Health website. These activities can be very beneficial and help improve well-being. Many women will look to massage or alternative healing energy therapies, supplements like taurine, B-complex vitamins, which can help support neurotransmitters. Aromatherapy like lavender is very soothing. Others may want to seek out a functional medical doctor. And I've interviewed Dr. Sobia Khan, who's in our Center for Specialized Women's Health, and she completed our 2-year fellowship in Specialized Women's Health, and then she went on to get her doctorate in education, and then went on to get her training in functional medicine. And functional medicine looks at elimination diets, looks at supplements, looks at the gut microbiome, looks at activities and sleep and circadian rhythm, does a very detailed, comprehensive exam. In fact, Dr. Khan is going to be offering custom fit functional medicine evaluations for women seeking out this service. So look on our website on speakingofwomenshealth.com for more information. And if you don't live in our area or don't plan to travel to Northeast Ohio, there are reputable functional medicine physicians that you can seek out. And on the podcast that I did for physicians and nurses on the functional medicine treatments for menopausal symptoms, she talks about these resources and where you can find out and find these clinicians. One thing that I don't think we talk about enough, and I think is important, and I remember trying to teach my children this at a very young age, is altruism, the act of doing for others without concern for your own personal gain. It's a really healthy outlet to build a sense of self-worth and feel productive and gain pride in oneself by helping others. Now, some people take that to the extreme without caring for themselves, so it has to be balanced. But I think a lot of unhappy, lonely people have never focused or learned the importance and benefit of being outside yourself. And sometimes I think our society with social media is very, very focused on comparing oneself to others. And I think one important option for mental health is just to unplug, get in touch with yourself, your family, your friends, your spirituality, nature, and to set limits on screen time. certainly before bedtime. But I think to just take a vacation, when I've taken a vacation with my family, when there's no cell service, everybody doesn't have their phones at their fingertips. You have to really make a conscious effort to unplug. So some take-home messages as we wrap up this podcast in the warm, happy sunflower house is kickstart any program of psychological change, especially with focus on life transition. And one big life transition, and I try to do anticipatory guidance with my patients, is with retirement. People who don't plan for it, who just stop working, many times have an increase in health conditions. And so you really want to plan in advance. When I see women very involved with their children and loving every moment of the high school and middle school and elementary years, it does go by fast, and you have to plan for what you're going to do once you've successfully raised your children. So learn how to be in touch with what you want. I think a lot of us just are so busy and tend to just bury these thoughts out of either fear or just thinking we're not going to get our needs met. It's important to write down maybe a journal and focus on your goals. Vocalize some of your needs to those close around you to get some honest feedback. And pursue goals, even if you don't think it's an option, because people that are persistent and driven are generally more likely to get their needs and life goals met. Now, no one gets everything they want, and getting through life transitions can take a lot of work, even happy life transitions. But you need to advocate for yourself, get enough rest, not eat junk food. And if you're in the game, you have a far better chance of achieving your objectives and reaching a very healthy life equilibrium. And positive action beats passive resignation, especially when it comes to avoiding learned helplessness. A lot of people are naturally more introverted and don't necessarily want to be around a lot of people, but it's important that you help guard against loneliness, which is really at epidemic proportions. A lot of people get a lot of pleasure and good neurotransmitters and maybe even a lower blood pressure with pets. Others, it's just one more responsibility to their already high list. So it is very individual, and what works for you or your sister or your significant other or your coworker isn't necessarily going to be the right option for you. But positive action can certainly help improve your sense of well-being, reduce anxiety and feeling blue, and help prevent shortening those telomeres. And if you have suffered from depression in the past, you definitely want to get regular care and be alert to any kind of a relapse with significant life transitions. So thank you so much for joining us for this episode on anxiety and telomeres and holistic ways that you can improve your sense of well-being. If you've enjoyed this podcast and want to support us, our nonprofit, speakingofwomenshealth.com, you can hit the donate button. We so much appreciate being able to bring you just this fabulous free content. Please subscribe to our podcast and give us a 5-star rating. And you can subscribe on any place that you get your podcasts, like Apple iTunes and Google and Stitcher and Spotify and Podbean and Amazon Music. There's so many different sites. And if you're not sure, how to get that app on your phone, ask your family member or grandchild, and they can help set it up. And I just find it actually relaxing and refreshing to listen to topics I'm interested in when I'm exercising or when I'm traveling and have a little bit of downtime. Certainly I pick the topic to go along with what I think will be conducive. And just like reading is very relaxing and very good for your brain. But right before sleep, you don't want to be reading very complicated, technical, or any kind of disturbing material. The same thing if you're relaxing, watching a movie or show. It really should be a little bit more calming, later in the evening. And don't forget to listen to our tips on sleep. And sleep is very refreshing. It's anti-aging, and it will help keep those stress levels down. So I'm your host, Dr. Holly Thacker in the Sunflower House, and thanks for joining us for this episode. And please come back and join us for our next podcast.